Another important feature of MinRap is that when there's not enough appointment slots to meet demand, it turns into an instant read lottery. So people fill out this survey, will always get a real-time yes or no. And what we hope is that this helps patients get care as quickly as possible and as fairly. Right now, we have plenty of supply and appointment spots available for monoclonals, so the state is not in scarcity. But if it is, MinRap, working with other providers in our state, can help make sure that everyone has a fair shot if there's not enough to go. I do want to reiterate what Dr. Linfield said. If you get sick with COVID-19, there's good evidence that these monoclonal antibodies can reduce the chances of needing to be hospitalized among high-risk patients. It's my hope that the work with MinRap and other providers in the state, that we can connect more and more patients to these therapies moving forward. Let me hand it back now.
Thank you very much to all of our speakers. And operator, we are ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the pound or hash key. Please stand by while we compile the Q&A response. Your first question comes from the line of Yoki of Fox 9. Please go ahead, your line is open.
Hi, everybody. Chris, I'm going to ask a clarifying question here, and then I'm going to get to my other question that I had. For clarity, on the long-term care residents who can leave the facility for up to 24 hours, is that only for residents who have been vaccinated, or is that any resident?
That is actually any resident, so it's regardless of vaccination status.
Okay, got it. And then my other question is on, there's been a lot of talk about vaccine passports, proof of vaccine. Obviously, a lot of more people are getting these, index card size vaccination cards, and wondering what happens if I lose it. I know you've previously advised to take a picture of it, but if they do lose it and they don't have a picture, is there a way for them to get proof of vaccination from the health department?
Yes, well, definitely, because we're wanting to vaccinate 80% of the population, we're hoping that most people will not lose their cards and will take a picture. But our Minnesota Immunization Information Connection does have that information. And so just like people can call us with questions about other immunizations that they've received to check on them, they would be able to check for the COVID-19 vaccine. But as I said, our preference is certainly that people are attentive to the card and also take a picture just so that they make sure that they have, a copy of that.
Got it. Is MDH only able to release that information out of the mixed system to the person who's calling about their own vaccination status? In other words, is it private? It can't be shared with anybody else?
Correct. That is private health information and could not be shared with anyone other than specific information could not be shared with anyone other than the individual. I mean, obviously, you see the data that we put on the website, which is aggregate data. But when it comes to an individual's information, it cannot be shared. The only other person or persons that would have access would be the healthcare provider, someone who's providing care to that person. But you could not call us and ask about my immunization information.
Okay, got it. Thank you.
The next question comes from Jeremy Olson of Star Tribune. The line is open.
Dr. Linfield, is genomic sequencing telling a little bit more about the story of the B117 variant in Minnesota? Did it start with this Carver County outbreak and spread to the rest of the state? Was it already in lots of places before we found it? And do we have any idea of how it got here in the first place? Any more information on that?
Great questions, Jeremy. In order to do that, we would have to put all our sequencing data on a phylogenetic tree. We have put some on, but not all on. And we did detect cases that actually, I believe, went back to the end of December. So before we started to see the outbreak in Carver County, we have detected cases throughout the state. So, you know, it is a variant that's very successful, that has the ability to spread quickly, and it is really rising in many places in the United States. So I suspect we had multiple introductions and then spread, but we'll learn more.
I also was curious about, I mean, it's been about 3-4 weeks since the announcement of that Carver outbreak, the 2-week pause recommended on sporting activities, testing clinics set up there. I'm just wondering if all this effort worked. Was there any sign of kind of stemming the outbreak in that region? Any sign of progress in doing all that effort to try and slow it down?
Yeah, you know, public health is always challenging to document when things go well, right? I will say that we have not seen the same rapidity of growth that we were seeing in Carver County continue. It's sort of been continuing at that rate, and there are some other counties that have had more rapid growth. So it's a little hard to say. When we have continued to look at the cases associated with that outbreak, and I think at the last count, we were up to, I just want to double check that it is 189. It is. There were 189 cases linked to the outbreak. And we have now confirmed B117 in 49 cases. And you may recall that a couple of weeks ago it was 140, right? So I do think that the measures made a difference. This is a very contagious variant. We estimate 50% more contagious than the regular strains. And so I do think that we may have seen a lot more cases. But I do want to say that we're seeing this in many places in Minnesota. And so it isn't just a Carver County problem. You know, we're having increase in growth in many, many parts of the state.
Yeah, thanks, Ruth. I think that's a really important point, that Carver sort of served as a reminder of what could happen across the state, and we are seeing that happening.
I hate to monopolize, but if things might have worked in Carver, are those strategies being implemented then in other areas where you're seeing this kind of growth?
Yeah, I mean, we are making recommendations. Ruth, do you want to comment more specifically, or?
Sure. You know, we are in close touch with schools and with youth sports, and we continue to work very hard with these groups to ensure that they are using prevention measures. We continue to investigate clusters and outbreaks, and continue to assess what we can do. And as I said earlier in my comment, I am worried about the spread of B117, and I really urge Minnesotans to be patient and to continue to mask and to continue to socially distance, and continue to roll up their sleeves to get vaccinated. I do feel like we are at a critical juncture. We've talked about it on these calls in the past, and it really does feel like a race of the variants against the race of people getting vaccinated against the variants. And we want to win this race. And it's a wonderful thing that we now have opened up to the broader Minnesota community to get vaccinated. But we all have to work together here because it's a contagious virus. And the way to win is for all of us to do our part in preventing transmission.
Thank you.
Your next question comes from Mark Checklist of Municipal Public Radio. The line is open.
Hello, this is a good segue, everybody, to what you were just talking about. You're talking about wanting people to, take protection, social distance, mask wearing, things like that, and then to get vaccinated. You're saying the vaccines are safe. We're hearing from all kinds of people that they're just really struggling to try to get appointments, even though they are eligible. And many are telling us they're driving hours to get the shot, and then in many cases have to go, weeks later to get it again. What's your message to people that are very frustrated because they're told that they should be getting vaccinated, that they're eligible, but they can't get an appointment?
Well, certainly I think this is where perhaps we have to let people know that when we opened up eligibility, that did not coincide necessarily with a subsequent increase in the number of doses that we were receiving. One of the things that we're continuing to do is to focus on immunizing for impact. And so that means that even as we've opened up, our healthcare providers are still finishing up some of the groups who were, in the earlier prioritization. Part of the reason why it was important to open up when we did is we need to make sure that we are able to continue to have a steady flow of people to get vaccinated so that we can maintain that high throughput. We want to make sure that we're continuing to be able to vaccinate at fairly high levels. Now, the challenge is obviously that we just added our entire state population. That's a lot of people. And although our vaccine allotments have increased over time, certainly they're not sufficient that we could do the entire eligible population in a single week. And so the eligibility just opened up on Tuesday of this week. And so people, need to recognize that it's going to take, just like it took a while for us to get through that 65 plus population, it's going to take a while to get through the 16 plus population. So we're delighted that people are eager and wanting to be vaccinated, but we do need to remind them that they need to be patient. And I think the news today about the Johnson & Johnson vaccine, although it appears that it won't affect Minnesota, is just a reminder that things can happen that can impact the availability of vaccines. And we need to be patient and flexible. So I'm sorry that people are having to drive a long distance. On the other hand, I'm delighted that they are eager and committed to be vaccinated. There will be enough vaccine for everyone in Minnesota. It just won't be here by tomorrow. And so we need people to be patient and continue obviously to look for vaccine opportunities, but know that your time will come and you will have the opportunity to be vaccinated.
A quick follow-up. Are you matching the doses with the demand based on geography? How do you do that?
We're looking at a number of factors as we're allocating the vaccine doses. So we want to make sure that we have geographic equity. We're also looking at the doses that are coming in through the federal retail pharmacy program and looking at how that impacts doses available across the state. We want to make sure that, we have equity between Greater Minnesota and that we have equity between Greater Minnesota and the metro area. And one of the things that we are looking at and will be looking at is just saturation. So if we look at a particular region, and obviously we just opened up, so this is a little bit early, but we did do this with the 65 plus. If we saw that the uptake was flowing in a particular region, then we make sure that, they're still getting vaccine, but that we may, redirect that to another region where there's much greater demand. So there are a number of factors that are being balanced. Geographic equity, making sure that we are, getting vaccine and making vaccine available to our populations of focus, making sure that, we're considering uptake and, kind of parity in terms of are people getting access to doses at about the same time? It's quite complicated, but we are looking at a number of factors as we're trying to work through the allocation.
Thank you very much.
The next question comes from Sue Kraft of Monument Pioneer. The line is open.
Thank you. Can you please provide an explanation? Because the questions I myself have been asked, why after someone has received both doses or is fully vaccinated and has waited the 2 weeks, why they must continue to mask in public and avoid close contact with those who have not been vaccinated? Thank you.
Sure. So the question was, why does someone who's been fully vaccinated still need to sort of participate in all of the mitigation efforts? And the reason for that is because there had been a lack of information about the impact that the vaccine would have on asymptomatic transmission and asymptomatic disease. So, and I've talked about this before, but clinical trials that were done, the endpoint was clinical disease. That means that they were looking to see if the vaccine prevented someone from having clinical symptoms and clinical disease. They were not doing testing to see if the vaccine prevented asymptomatic disease. And because of that absence of data, we couldn't comment on whether or not the vaccine was able to prevent asymptomatic disease and hence that asymptomatic spread. Certainly, our feeling has been that just based on biology, it's very likely that that would be the case, but there hasn't been data. And the study that I referenced today that looked at real-world vaccine effectiveness, this was a study that did indicate that there was some good effectiveness in preventing both symptomatic disease as well as asymptomatic disease. And that adds to the information that we have. And so there will be more and more studies like this and more data. And I think ultimately there will be some changes to the recommendations. But until we have really a great deal of clear, strong data, that is a safety net. And that is why that continues to be the recommendation. Because we don't want someone who's been vaccinated to inadvertently develop asymptomatic disease and infect someone else.
Okay, so potentially those that have been vaccinated could still be carriers then?
Yes, I don't know if I'd use the term carrier, but potentially they could become exposed and develop disease that does not have any symptoms, so they wouldn't be aware and could potentially be infectious to someone else. As I said, the data that we're seeing now suggests is positive that the vaccine seems to provide protection against that asymptomatic disease, but we'll want to make sure that there's more data like that and very multiple studies that show the same thing. And I think when we have that type of information, then there'll be the opportunity to make some changes to the recommendations.
Okay, and then with regards to children and potential vaccinations for them, are any of the trials taking place here in Minnesota?
There is, I'm aware of a Moderna vaccine trial for 12 to 17-year-olds that's happening in Minnesota.
Where is that taking place?
I believe that is based out of the metro area. I don't know that there's any geographic boundaries to who could participate, but I think the location is in the metropolitan area.
And that's for 12 and older?
12 to 17-year-olds.
Okay. Thank you.
Operator, we have time for one more question.
Okay, and the last question will come from Crystal Bree of KSTP. Your line is open.
Hi there. I have been hearing more and more ads to get the vaccine, and I'm wondering with the amount of demand for the vaccine right now, I'm curious if you know how much the state is spending on the COVID-19 vaccine campaign, and if you feel that sort of campaign is still needed with the demand we're seeing.
Yes, definitely. You know, right now we are in a place where all of the people who are eager to get vaccinated and feel comfortable with that decision and have kind of already made up their mind are seeking and pursuing vaccination. And as I said, you know, these enthusiastic folks need to be patient. There will be time, and they will all have access to vaccine. But we do know that in the next few weeks, as we get more and more people vaccinated, that we will reach a point where folks who still have some questions and perhaps want to have, you know, further discussion or want to think about it more, will be the group that we're trying to reach. And so it's really important that we continue to provide them with information, to remind them of, you know, why are we pursuing vaccination in the first place? What are some of the things, the positive things that we can get back to? So right now it does seem like, why would we do this? And yet we recognize that there are people who have questions and who want to, you know, still are thinking about this, and we want to make sure that we're putting information out there to let them know how safe and effective the vaccines are and how important it is that they're vaccinated and what a difference that will ultimately make for them, for their family, and for their community.
And do you know by any chance how much the state is investing in these campaigns?
That is something that we could get for you. We did receive federal funding that is specifically covering this. And so we can get you the actual dollar amount at this point.
Okay, thank you so much.
Okay, I'll turn the call back over to the presenter.
Thank you, and that's all the time we have for today's COVID-19 media briefing. If there is a question that you were not able to ask during the call, please feel free to reach out to our media team at Minnesota Department of Health. Thank you all and have a great afternoon.
And this concludes today's conference call. Thank you for participating. You may now